For years we've just used hormonal manipulation for the treatment of prostate cancer, and in the last few years we were then able to use docetaxel chemotherapy when people became hormone resistant, and we didn't have a lot of other options after that. And then more recently there's been two specific drugs, abiraterone and enzalutamide, that have been used, and there's been strong evidence for their use both after chemotherapy and before chemotherapy. They improve patients' quality of life, increase survival, and generally are better tolerated than chemotherapy. The trials were done initially in the post-chemotherapy setting, and they've been available in that setting for general use for 2 or 3 years now. It's been more difficult in the pre-chemotherapy setting because although the data has been there, we haven't had the availability. It's been slightly different in Scotland and England and some of the other devolved nations in terms of the access that we have. In England there's the Cancer Drug Fund, so both of those drugs have been available more readily in England. In Scotland, obviously where I work, we've actually had very limited access to pre-chemotherapy, abiraterone and enzalutamide. That's just beginning to change, and there's been some decisions in the last month that have changed that. So it's making a huge difference to patients' lives. We're managing to treat them now with better tolerated treatment much earlier and maintain their quality of life and put off having to start chemotherapy for up to 18 months or longer. There's general quality of life issues, and then there's often quality of life issues that specifically affect prostate cancer patients. And the things that we see in prostate cancer patients specifically that affect the quality of life are often pain, because prostate cancer patients typically will get bone metastases from their prostate cancer when it becomes metastatic, and so often they have a disease in their spine or their pelvis. It tends to be weight-bearing areas that get affected by the disease, and so they have pain in their hips or pain in their pelvis or pain in their back, and that really stops them from doing the things that they like to do. They can also get things like fatigue, poor appetite, and just generally their activity levels go down. So things like doing their normal day-to-day activities are very much impaired. There's also impairments of quality of life associated with the treatment that we give them. So generally speaking, when they're on their hormone treatment, they get some hot flushes, they maybe get a bit of weight gain, a wee bit of fatigue, but they can tolerate them quite well. Chemotherapy, which actually is usually not as bad as they expect, there are still some fairly significant toxicities associated, and as they go through the course they get increasingly tired and have things that really can affect their quality of life. Whereas with those new tablets that are coming through, we can start them earlier and we can keep them at a level where they have very, very few symptoms from their disease, but they also have very few side effects from the treatment itself, and so they can carry on ideally with as much of a normal life as they can, do their normal day-to-day activities without much impairment. A lot of the psychological issues surrounding cancer are just having to live with it day to day, and yes, there's physical things that stop them from doing things, but there are many of the psychological aspects of both their disease and their treatment. For example, with chemotherapy, they often lose their hair, or their hair thins, or they can't do as much as they did, and that reminds them every day that they've got cancer and they can't do what they were doing before. If they go out, people say, "What happened to your hair?" or "What's happened to you?" And it's a constant reminder. If they're on a tablet that doesn't give them any side effects and shows no outwardly evidence that they're on any treatment, they're more able to have a normal life because they're not having to have questions all the time about how they are. And so I think they feel a lot more confident, and psychologically that's very important to them as well. They feel more normal and they feel like they can have a normal life. And it is quite a... We have a lot of patients when they are coming to the point when their hormones are not working, and we're talking about treatment, and it's amazing how important it is to them to not start chemotherapy. It seems to be a huge psychological, not just about the physical side effects, it's a big psychological hurdle. Having to start chemotherapy, I think in a lot of their minds, means the beginning of the end, and often that's not the case, but that's how they see it. Whereas if you can say, actually, we've got a wee tablet for you that'll be fine, they feel much better about it.